Here at Appalachian Regional Healthcare, we go above and beyond to make sure our employees are happy, both professionally and personally. That's why we offer a full range of benefits and perks to ensure our team members have everything they need to work and live successfully. That includes flexible scheduling, short and long-term disability, retirement plans, and team share bonuses. Not to mention, ARH employees are among the best paid in the region, with paid vacation, holidays, and sick days. And because we're a hospital system, of course our health insurance coverage is second to none, with inexpensive premiums and most services received free at our ARH facilities. Speaking of health insurance, we get a lot of questions about the details of our medical benefits plan. So let's take a few minutes to go over the basics. We'll also cover pharmacy benefits, so stay tuned till the end. The best thing to remember is this. When you're seeking care, we highly recommend using our own Tier 1 ARH facilities, as there's less cost to you. In fact, most times the service will be free to covered members, with some notable exceptions. Here's how it works. ARH divides care providers into 3 levels of coverage. The level you choose determines how much you pay. Tier 1 providers are ARH-owned hospitals, clinics, and other services like home health and home care stores. These offer the greatest level of coverage. ARH employees can use these Tier 1 providers in either Kentucky or West Virginia, no matter which state they work in. For these ARH-owned providers, you will have no out-of-pocket expense, except a few cases where co-pays apply. Tier 2 providers are ARH approved, but not owned or employed by ARH. For these providers, your office visit will be paid for, but you'll pay your deductible and a percentage of any cost beyond that. Tier 3 providers can only be used if the services are not available at ARH, like pediatric specialties, organ and bone marrow transplants, and hand surgeries, for example. If a service is available at ARH, but you still have the service at a Tier 3 provider, you will owe the entire cost of the services you received, which can be very expensive. An exception to this are ER visits. We recommend always contacting your benefits administrator before visiting a Tier 3 facility. So to recap, for the least out-of-pocket expense, use ARH-owned services. The most out-of-pocket expense will be for non-ARH-owned services that are available at ARH. ARH-approved providers will be somewhere in the middle. Take this case, for example. Let's say you're not feeling well and need to go to the doctor. You have an office visit and get some lab work done. If you go to a Tier 1 ARH doctor, there would be no cost to you. Your visit and the lab work would be free, so $0 out of pocket. However, if you choose to go to a Tier 2 approved provider, the office visit will be free, but any tests or lab work you have done in the office would be applied to your insurance and deductible, which means an out-of-pocket expense for you. Now let's say you go to a Tier 3 provider in the Anthem network. The cost of your test and lab work, as well as the cost of the doctor visit, will depend on whether or not the service was available at an ARH-owned or approved provider. If the service is not available at ARH, your deductible and coinsurance will apply. If the service is available at ARH, you will owe the entire amount, both of which mean, you guessed it, more out-of-pocket expense for you. Of course, there are exceptions that may apply, depending on the service or facility you use. So if you're thinking of going to a non-ARH facility, contact your benefits administrator to find out more about what options are available to you. Our annual benefits guide, available at teamarh.org, also includes more detailed information that may be helpful. It's also important to know that there are a handful of medical facilities that are not covered by ARH insurance at all, except for emergency services, which are always covered no matter where you go. These include non-ARH healthcare providers outside Kentucky and West Virginia, with few exceptions, as well as a few of our direct competitors. Some services are restricted too, which means you must visit an ARH facility to have them done. When it comes to your prescriptions, there are a few things to keep in mind. When possible, you should always use an ARH pharmacy unless the need for the medication is urgent. Non-ARH pharmacies may be used for critical medications like antibiotics and pain medications, or for one-time fills of maintenance medications. However, they will be more expensive than if filled at an ARH pharmacy. Also, specialty medications must be filled at an ARH pharmacy unless otherwise approved. Got it? Great! Now that you know the basics about ARH benefits and how they work, let's talk about how to enroll. There are 3 ways to enroll in the ARH benefits plan. When you're first hired as an ARH employee, you will be given an enrollment period during your orientation. You must enroll within that period to be eligible for benefits. If you don't enroll during that initial enrollment period, you'll have another chance during our annual open enrollment, when all employees have an opportunity to enroll or change their coverage. The annual open enrollment dates are published each year and available to all eligible employees. The 3rd way to enroll is when you've experienced a qualifying life event, like a birth or adoption, change in marital status, or change in employment status. In these special cases, you may be able to enroll or change your coverage within 30 days after the life event occurs. Of course, if you ever have questions about your coverage, don't hesitate to contact your benefits manager for assistance. Or visit the ARH HR website at teamarh.org to review plan information, policies, and much more. Appalachian Regional Healthcare. We believe in me.